Hi, my name is Michael. I'm the director of Blue Ridge Christian Counseling. And the question submitted today is, what does confidentiality look like in counseling? And there's a clear legal answer to this in a counseling center. And it means essentially that what you say here will stay here, with the exception of if you say something about harming yourself or harming someone else, or if you tell us about the abuse or neglect of a child or an adult dependent, then the legal mandate is that we have to disclose. We have to help prevent danger. We have to help to make sure that someone outside the room is safe and someone in the room stays safe, and that children and other vulnerable populations are protected. So we are legally mandated to report those things, but also we're ethically mandated because we want to help. That's what we're here to do. So there's no such thing as an absolute confidentiality. On the other hand, it's a very strict, legally binding confidentiality. We don't share things outside of those exceptions, or if there's a legal subpoena, or so, there are proceedings where we are compelled to. But otherwise, what is said here stays here, and we find that is an important piece of counseling that allows us to get to pretty sensitive things quickly, because there's that trust, there's that promise, there's the pledge to keep it in confidence, to keep it discreet. Now, one provision that we invite people to take is to identify someone in their life, whether that's another provider, maybe a former counselor, or maybe a psychiatrist or a medical doctor, a pastor or a mentor. There's sometimes where someone else in the picture would be really helpful to have on that care team. And so we don't feel, as a counselor, I don't feel that that the confidentiality has to be so tight in every case. Actually, opening up a team could be really helpful for many problems. Say a couple is struggling, a married couple is struggling, and if the husband has a mentor, the wife has a mentor, they have a couple they get together with once or twice a month for dinner, for encouragement and help. If I could have a conversation with that mentor once or twice over the course of counseling, maybe I could be of help to that mentor. Now, I think that could be a really beautiful thing, a really helpful thing. So in our confidentiality forms, our informed consent, we give people the option of identifying someone who's in that category. Is there someone you'd like us to connect with to coordinate care, or to share particular things in particular cases? But that's something the person has the choice over legally. And so the person who's coming to counseling gets to say, yes, I want to take part in that, or no, for whatever reason, this is something I prefer not to address in that way. So it's our commitment to you to hold the highest standard of confidentiality, because these details matter. These personal stories, some of our past sufferings, trauma, abuse, some of these things. You want to create a safe space, a place that could be trusted with working through the hardest things in life. And that's what we pledge to offer, and that's what we commit to abide by.